You know those little kids that throw temper tantrums and hit their parents in the middle of the restaurant while you're trying to enjoy your meal? Well, they may be suffering from more than just bad parenting or the terrible twos. They may be suffering from a disease that is more common in adults, but can also affect children. It is early onset bipolar disorder. And today I will be telling you about the causes, symptoms, and treatments of this disorder. You may be wondering how such a complex and destructive disorder can be common in children. Let me tell you. One cause of early onset bipolar disorder is drug and alcohol abuse of the mother during pregnancy. The drugs and alcohol affects the fetus's brain, causing abnormalities in brain function. However, most cases appear to be caused by genetic factors. Studies have shown that children of parents who have bipolar or other mood disorders are more likely to have bipolar tendencies. Genes affecting neurotransmitters in the brain have been shown to be connected to bipolar disorder. A very high or very low amount of neurotransmitters such as serotonin or dopamine, or an imbalance of such, have been shown to cause bipolar disorder. While it does not cause bipolar disorder, stress can be contributed to it. Many events can be deemed stressful to a child, such as death in a family, new sibling, potty training, start of school, or even abuse. After a stressful event triggers the disorder, there's really no way to stop it. The disease just advances from there. And now that I've told you about the causes, let's discuss some of the symptoms. The symptoms can be divided into 3 categories: very common, common, and less common. Some very common symptoms of bipolar disorder are temper tantrums, rages, irritability, frequent mood swings, silliness, aggressive behavior, carbohydrate cravings, and social anxiety. Some common symptoms are rapid or pressured speech, obsessional behavior, learning disabilities, lack of organization, bossiness, lying, and destruction of property. Some less common symptoms are migraines, binging, self-mutilation, and cruelty to animals. And now that we've talked about the symptoms, let's discuss some of the treatment options. Most treatments for bipolar disorder are medicinal. These include prescription of 2 or more mood stabilizers such as lithium, along with various other drugs to combat the symptoms of this disorder, such as anti-anxiety and antipsychotic medications. And since all children are different, a trial and error method is usually used to determine a successful drug regimen to prescribe. And the side effects of the medications prescribed in the treatment of bipolar disorder are very widespread and can even be dangerous. They can range from weight gain to polycystic ovarian syndrome in women. And some people who take lithium may need to take thyroid supplements and are at risk for kidney disease. Other treatments such as psychotherapy and therapeutic parenting, when combined with a successful drug regimen, can also be used in treatment. Parents can teach their children relaxation techniques and use a firm hold during rages, reduce stress at home, and keep a routine structure to provide help against the disease. And keeping all of this in mind, allow me to conclude by saying that since we've gone over the causes, symptoms, and treatments, maybe you will think twice before accusing the parents of those children of bad parenting. Thank you.